And now I'll move on to the assessment of the mouth. I'll just start off by inspecting the lips, the outer, and noting for color, moisture, lumps, ulcers, crackings, or scaliness, as well as inspecting the oral mucosa and noting color, areas of pigmentation, ulcer, patches, and I'll be doing that with my pen light. And then I'll also be inspecting the gums and the teeth, noting for color, swelling, ulceration, bleeding, retraction, abnormal position, or looseness. And then I'll also be inspecting the tongue and the floor of the mouth, noting color and texture. And for this part of the assessment, I will use gloves, being that I'll be inside of the oral mucosa. Just going to inspect your mouth. Symmetrical, no cracking, everything noted. And because I do not have a tongue depressor, I will be using my finger to inspect. You can please open up your mouth. And can you stick out your tongue as far as you can and say, ah? Perfect. Thank you. Thank you so much. And now I'll inspect the tongue and the floor of the mouth and noting color and texture. And I've just inspected the pharynx and the soft palate and the anterior, posterior pillars and the uvular as well as the tonsils, and noting the rise and fall of the soft palate as the patient was saying ah. But in order to inspect the mouth and the floor, I will need to use this to manipulate the patient's tongue. So if you could please stick out your tongue for me again. Thank you. I'll just use this to move it to the left to check the floor. Thank you so much. I'll do the same for the other side, noting the floor of the mouth. Thank you so much. That was perfect. No swelling, ulceration, or exudate noted. Now for the final portion of the assessment, I'll go ahead and assess the patient's neck. And I'll just start off by inspection. Inspecting the neck and noting for symmetry, any masses, scars, enlargement of the glands, or visible lymph nodes. Then I'll go on to palpating all 10 of the lymph nodes, noting size, shape, mobility, and consistency, and asking if there's any pain or tenderness. And then I'll inspect and palpate the trachea for deviation, and then also inspect and palpate the thyroid gland at rest, and with swallowing, noting size, symmetry, consistency, tenderness, and nodularity. So if you could please just lift up your chin slightly so I can inspect your neck. Thank you. Do you have any pain here? Perfect. The neck is symmetrical. No masses, scars, enlargement of the glands, or visible lymph nodes noted. Now I will go ahead and palpate the 10 lymph nodes. Just face forward. Any pain? Any pain? Any pain? Just let me know as I go through if you feel any pain. Sorry. Did you feel any pain there? Okay. Thank you so much. And now, because I'm not able to stand behind the patient, I'll try and do it from the side. And okay, that would help. Thank you so much. And inspect and palpate the trachea for deviation, as well as inspecting palpate the thyroid gland at rest and with swallowing, noting size, symmetry, consistency. So the trachea does not appear to be deviated. Now from the back. Can you swallow for me, please? Perfect. Perfect. Do you feel any pain? Okay, thank you so much. And that will conclude the HEENT assessment for the head, eyes, ears, nose, throat, and